Healthcare Improvement in Pueblo, Colorado, Building on Common Ground, presented by Cameron, Amenia, Nari, Ray, and Tiffany. Pueblo, Colorado is described as a high desert city and is located on the Arkansas River where it joins with Fountain Creek. Only a few hours south of Denver and Boulder, the region has evolved around the steel industry. Closing all but one of its steel mills, the recent recession took a toll on the area's economy and has led to its current financial state, which has impacted the health of its citizens. At the time of the case study, 55% of residents were white, 41% of residents were Hispanic, with 2% being black and 3% being classified as other or non-Hispanic. 1 in 4 adults smoked and 1/3 were obese, with the majority of residents living on less than twice the federal poverty level. Although many residents have lived in generational poverty for decades, there has been a slight improvement in their economy with the repurposing of steelmaking equipment to make wind turbines and recycle scrap metal, as well as the opening of a solar farm. Another economic improvement is the legalization of marijuana. This added jobs, but has shown to have negative health impacts by attracting drug-seeking groups to the area where the cost of living is lower and putting a strain on the already limited social services available to its residents. Nevertheless, this area was able to improve their regional health system performance on the majority of measures for which trend data actually exists, being one of only 14 regions out of 306 nationally to make such advancements, which is noteworthy since higher income usually translates to better health outcomes. In terms of their health system characteristics, because of Pueblo's location and small size, healthcare services are concentrated within 4 main institutions, including 2 nonprofit hospitals, Parkview Medical Center and St. Mary Corwin Medical Center, as well as Pueblo Community Health Center, which is a federally qualified health center, and Health Solutions, a community mental health center. These providers are considered Pueblo's safety net. These institutions have fostered a culture of collaboration and a spirit of co-opetition. This is a willingness to work together to pursue a common interest while competing for patient loyalty. This is especially true for 2 hospitals in the region who actually share medical specialists. This is possible because these hospitals actually have routine meetings between their CEOs and have an open door policy with one another. Although the interdependence created between these 2 institutions is necessary because of a high patient demand and workforce shortages, it is also what allows this healthcare system to thrive through collaboration. As mentioned, collaboration is built into the culture of Pueblo's healthcare system, and this is evident in their goal setting as well. Although different institutions may set specific goals, they understand that in order to meet those goals, various sectors have to be on board and willing to contribute. One organization in particular helping to facilitate collaboration is the Pueblo Triple Aim Corporation. This nonprofit organization, whose mission is to make Pueblo County the healthiest county in Colorado through community problem solving and cross-sector collaboration, has numerous members, which includes leaders from the business community, philanthropy, education, social services, economic development, and members of the Latino and other ethnic community groups. These members, along with other nonprofits, assist the healthcare system's safety net with setting and meeting the goals of Pueblo's healthcare system. These goals include reducing patient harm and improving clinical quality and service in the Parkview Medical Center, increasing healthy behaviors, reducing obesity, reducing teen pregnancy, improving population health, and improving the experience of care for all citizens. In terms of strategies used to meet these goals, quality improvement has become a part of the culture of the healthcare system in Pueblo, and this is due in part because of Parkview Medical Center's commitment to reduce variation and promote evidence-based care, which has been a practice adopted by other institutions within the area's safety net. Other strategies that have worked incredibly in meeting the region's goals has been cross-sector collaboration and data collection. The data collected obviously depends on the particular goals. However, the healthcare system uses that data to define problems, identify gaps in care, and engage and promote shared accountability for solving problems. Additionally, when possible, the data is made available to the public and other interested parties so that the community is kept informed.
The key partnerships in Pueblo are with the government agencies such as public health and fire departments, business leaders, social service agencies, philanthropists, and educators. Most notably is the One Community Pueblo initiative from 2008 that involved health providers, educators, law enforcement officials, and judges in support of healthy child and youth development by promoting access to mental and physical health services. Some of these examples of partnerships include the fire department launching a pilot program called Directing Others to Service, the City of Pueblo enforcing code violations against landlords for health problems related to mold and bug infestations, religious leaders serving as community partners for hospitals by checking on ill congregation members and educating them on different health issues, local providers helping to enroll the community in health coverage during Medicaid expansion, which has helped Pueblo's safety net hospitals expand access to care while being rewarded for improving quality. Another partnership includes promoting nutrition by efforts to help food retailers purchase freezers or making changes necessary to sell healthier products. The significant factors that support these partnerships include high percentage of teen pregnancy, nearly half of its residents living below federal poverty level, many residents suffering from disabilities, strained social services due to the legalization of marijuana, and the city having a high rate of uninsured working individuals. The Medicaid Accountable Care Collective, comprising of several regional care collaborative organizations, has positively impacted the city of Pueblo by promoting care coordination and efficiency. The regional care collaborative organizations pay a fee of up to $12 per member per month to oversee medical management, provider network development and support, and performance reporting. Through the Integrated Community Health Partnership, the city hired nurses to serve as advocates and navigators on behalf of Medicare and Medicaid clients. The regional care collaborative organizations were able to bring partners together to identify what does and does not work in the community. This allowed Pueblo Community Health Center to create care coordination infrastructure that was not possible under traditional fee-for-service reimbursement. Using data and engagement from this diverse collaboration, Pueblo was able to cut its teen pregnancy rate in half with the cooperation and engagement of the stakeholders, as well as curb unnecessary hospital visits. Medicaid expansion allowed Pueblo Community Health Center, which is a federally qualified health center, to eliminate the wait list, allowing community health centers to hire more nurse practitioners and physicians. They were also able to improve their quality of care with the help of incentives from public and private insurers. Religious leaders' involvement helped to shorten hospital stays and increase the length of time in between hospital visits.
Pueblo's Public Health Department partners with the residency program at Parkview and St. Mary Carmen to promote colorectal cancer screening. They have been using a chart review and tracking system. This has led to an increase in number of adults screening for colorectal cancer. Case managers at the FQHC coordinates care for high-risk obstetric patients by screening appointments for them at St. Mary Crown High-Risk Obstetric Clinic, making sure they attend and helping them adhere to recommended treatment. As you can see, there is a graph provided on the study that shows that screening for colorectal cancer has increased from 2013 to 2015. In 2013, the screening for colorectal cancer screening went from 24.1% to 42.1% in 2015. Rethinking Health Initiative is a non-profit. This initiative promotes regional health improvement model to long-term effects of various health policies in Pueblo's residents. It looks at things such as healthcare costs, quality of care, equity, and productivity. This exercise has helped convince employers facing raising healthcare costs and the burden of safety net providers that making long-term, even modest investments in better health could yield the significant financial returns. Lastly, there has been an increase in 911 calls. From the year 2008, there has been 2,000 calls made, and in 2015, there has been 21 calls made. Some of the calls came from residents who would repeatedly fall in their homes, and others came from people who simply needed a way to access the healthcare system. This has resulted in 2016 the launch of pilot program called Directing Others to Service, or DOTS. In this program, the fire department staff and providers connect frequent users to the emergency response system with medical homes or other resources to help. The fire department staff would also visit frequent 911 callers to identify the needs, such as grabbing the bars in their bathroom or as eyeglass prescriptions as well. Since collaborations were essential to Pueblo's health system success, many organizations were not hesitant in order to join forces in the benefits of residents in Pueblo. The healthcare providers organizations has joined forces with the government agency, including the public health and fire department, as well as business leaders, social service agencies, philanthropists, and educators to address the community's health and social problems. Parkview Medical Center has contributed to this improvement by providing Pueblo's country's urgent care and emergency facilities with a list of local primary care physician information on school-based clinic and health department resources to share with patients. Some more example of community-based organization engagement includes Pueblo's public health department partnering with the residency, as mentioned before, at the Parkview and St. Mary Crowns to promote colorectal cancer screening through a chart review and tracking system, which has led to an increase in number of adult screening. Lastly, as mentioned before, firefighters has been a huge help to the community-based organizations in Pueblo. 911 calls has increased from the year 2008 to 2015, from 2,000 to 21,000. Most calls came from residents who would repeatedly fall or they needed access to health care system. This has resulted in the creation of a pilot program called DOTS, or Directing Others to Services, where firefighter staff and providers connected frequent users of the emergency response system with medical homes or other resources to help them. Firefighters would repeatedly answer the frequent 911 callers to make sure to see if they can help their needs.
Communities address the needs of at-risk populations mainly through co-opetition. Pueblo has been described as an area where medical resources are limited. Therefore, through co-opetition, medical providers work together to facilitate patient care. No patient is ever denied entrance into an emergency department at any medical center, and local providers are actively advocating for the expansion of Medicaid while assisting the residents of Pueblo with enrollment into health insurance plans. Also, the institution of hospital provider fees allowed facilities to recuperate costs through federal matching funds, which increased coverage to low-income individuals and families and nearly eliminates uncompensated care. Parkview Medical Center has played a key role in addressing the population's needs by providing lists of primary care physicians, information about school-based clinics, and health department resources in all urgent care and emergency facilities. Parkview also boasts retaining more than half of its medical residency graduates, which accommodates patient demand for healthcare services and providers, thus expanding primary care capacity. Moreover, Parkview established its own federally qualified health center through opening a primary care clinic. The clinic hired nurse practitioners and physician assistants, which eliminated patient waiting lists and allows for same-day and next-day appointments. Social determinants of health were included in regional efforts through direct interventions in behavioral health, particularly in nutrition. As we have mentioned, Pueblo, Colorado is isolated geographically, and many of its residents are of a low socioeconomic status. Diabetes is most prevalent in this community due to lifestyle factors such as smoking and obesity among adults. The population is predominantly Hispanic, and many residents are disabled. In 2013, after discovering that 17% of residents did not have access to healthy food options, St. Mary Corrin Hospital launched a farm stand to combat the food swamp and food desert in their neighborhood. The desert refers to the lack of nutritional food, and the swamp refers to the abundance of cheap food that has low nutritional value. Physicians at this particular hospital have obtained a special privilege in writing prescriptions for high-risk patients to receive free fruits and vegetables at the farm stand. Also, the local public health department helped local food retailers purchase freezers or make other changes necessary to purchase healthier food products and lobbied to open a Walmart in one of the poorest neighborhoods. In addition to leading their community into a nutritious lifestyle, St. Mary Corrin Hospital was instrumental in their partnership with the city government to enforce code violations against landlords for problems with residences that affects health, such as the growth of mold and mildew, which can negatively impact the respiratory system. The growth of mold and mildew can impact anyone, but is more likely to plague those in impoverished communities where building fixtures are commonly old, outdated, and the property is not maintained.
Although Pueblo has been highlighted because of its community and multi-sector collaboration, there was an organization that served as the backbone for healthcare, Parkview Medical Center. This organization took control and provided the community with endless opportunities to improve their healthcare system. This community was known for its low income and limited resources when it came to this area. However, the Parkview Medical Center provided this community with lists of local primary care physicians who could help them in addition to information pertaining to school-based clinics for children. The establishment of school-based clinics made it possible for students who were uninsured or relied on government insurance to receive proper health care. These services included, but were not limited to, basic primary care, birth control, physical examinations for sports, vaccinations, and referrals. Parkview's main goal was to improve the quality of healthcare and reduce the chances of harm being caused as a result. In terms of addressing social determinants that were presented, Parkview initiated nutritional programs to promote a healthy diet and lifestyle. This organization provided this community with nurses at local venues and work sites where they offered services like diabetes screenings and basic dietary recommendations. Parkview's commitment to improvement is what spurred on the other institutions in the system and helped them improve at various levels and meet their goals. In addition to Parkview, the Pueblo Fire Department stepped up during this time. They took a load of 911 calls that were pouring in. The calls increased from 2,000 in 2015 to nearly 21,000 in 2018. The fire department established a frequent caller program, which would essentially limit the amount of 911 calls that the emergency system encountered. One of the most important leadership lessons that was demonstrated in this case study was teamwork and willingness to accept help or assistance. Many of the healthcare issues presented in Pueblo, Colorado required multiple organizations to resolve them. The Parkview Medical Center played a huge role in terms of co-opetition. This included different organizations and healthcare personnel to provide care, mentoring, and assistance to those who needed it. Communication between the organizations was vital. The Safety Net Hospitals of Pueblo established an open-door policy which allowed them to tackle healthcare concerns of the community. This also allowed patients to go to either of the two hospitals to receive care. Lastly, innovation in the establishment of change helped resolve healthcare concerns. Teen pregnancy was one of the many issues that presented itself in Pueblo. Through the creation of LARC and making it free to low-income families, it resulted in a 50% decline from 2009 to 2015. These leadership lessons are a few of many that were helpful in establishing proper health care to the citizens of Pueblo, Colorado.
All in all, one of the major takeaways from Pueblo's case study is that collaboration is key, requires committed stakeholders from multiple sectors, and will have a positive impact on the people working within the system and those serviced by the system. This is apparent through Pueblo's ability to improve its healthcare quality and access during the years of the case study. Additionally, Data collection played an enormous role in informing the stakeholders of the gaps in care and the improvements that needed to be made to ensure that the programs and practices being implemented in Pueblo were necessary and met the evolving needs of the community. Pueblo's multi-sector partnerships also showcase the importance of applying a systems-thinking approach, since there are multiple sectors involved that are working together to solve complex problems surrounding health and the healthcare system. Although this case study only covered the small city of Pueblo, the success of the programs they created through an interconnected health system is a great example of how health systems in different cities could benefit if they take the necessary steps to build and maintain relationships with stakeholders outside of public health communities. Thank you.